Welcome, this is Margaret Flowers with Popular Resistance. Welcome to COVID-19, how weaponizing disease and vaccine wars are failing us. We're going to give just a few minutes for the participants to all join. So if you'd like to, while we're waiting, you can use the chat feature to send a quick message saying where you're coming in from. It's always fun to see where folks are coming into the webinar from around the world. So we'll start in a few minutes. Welcome to everyone. This is Margaret Flowers with Popular Resistance, and we'll be starting in just a minute or two to give time for folks to join. And as you see in the chat, folks are sharing where they're coming in from, so feel free to do that. Welcome everyone to COVID-19. Let's go ahead and start the program.
Okay, we're about ready to start. I think we have a tremendous group on, and welcome. I'm so glad you've joined us for tonight's webinar, COVID-19, How Weaponizing Disease and Vaccine Wars Are Failing Us. I'm Sara, Flounders, an editor and one of the 50 co-authors of Capitalism on a Ventilator, The Impact of COVID-19 in China and the US. It's published by International Action Center and the China-US Solidarity Network. And I'm joined tonight by a great panel of some really important co-authors of Capitalism on a Ventilator. My co-editor, Li Suhin of the China-US Solidarity Network is here speaking to us from Shanghai. And 4 of the authors of some significant chapters are joining this panel. Margaret Flowers, a doctor and pediatrician, co-founder with the much missed Kevin Zeiss, and a co-director of Popular Resistance is here. Margaret is a co-host for tonight's program. And we're also joined by Margaret Kimberley of Black Agenda Report, Black Alliance for Peace, a senior editor of Black Agenda Report, by Vijay Prashad, the director of Tricontinental Institute for Social Research, and by Max Blumenthal, the co-founder and editor of Gray Zone. So these are really tremendous reporters, journalists, writers, activists that I'm sure many of you are already well familiar with. We wanted to meet after the new Biden administration to evaluate where we're at, evaluate the new vaccine distribution, what it means in the US and the world. So restricted to the wealthiest countries, leaving out most of the world. We're discussing a recent book where the last piece was written as we went to press just over 3 months ago, and that seems an age in terms of the numbers. Some of the chapters reporting 8, 9 months ago, even 5 months ago, it's staggeringly worse than any of us could have possibly foreseen, now reached and past 400,000 deaths, and much worse is predicted. We're looking at a global pandemic, an escalating political, economic, and propaganda attack on China. We find that US capitalism is deeply threatened by a powerful country able to use socialist state planning in dealing with both a global capitalist crash and a global pandemic, and is now surging ahead in production. While here we face great deterioration, and it may get much worse. So part of that is a discussion today. From the first days, the COVID-19 virus, when it was first discovered in China in late December of 2019, China rushed to alert the World Health Organization, all the countries of the world, on a dangerous new virus. Even before the first death in China, the DNA was identified, tests were prepared, and that's when I started following this crisis. Following it from the point of view, and I think it's true for many of us tonight, I was interested in learning why and how China, as a rapidly developing country that's building socialism, how they would utilize socialist planning in dealing with this new challenge. I was interested in their stay-in-place freeze at the same time that they guaranteed paychecks and a hold on rents and mortgages and credit card payments, no fear of evictions, providing food deliveries, arranging mass testing. So little was being written on this that started collecting it and exchanging it with others. So it's hardly surprising, but it's still shocking to watch the US response from both political parties. This was not only the response from Trump. And I think that's important to keep in mind now that there is a new administration. Rather than preparation in the US, there was an unprecedented wave of ridicule, criticism of China for taking extreme measures, open gloating hoping that the virus outbreak would undermine confidence in the government, would lead to social chaos, predictions of mass social unrest at the quarantine measures, just an anti-China drumbeat that reached new heights, trade war, military encirclement, and here in the US, no preparation for mass testing, supplies, hospitals, or education of the population, just ridicule. 2 months later, when the virus hit, I'm speaking to you from New Jersey, from Jersey City. In New York and New Jersey, a spike so sharp from the shutdown of March 15th, I don't think any of us could ever forget the searing images of thousands of medical workers wearing rain ponchos, garbage bags, shower caps, bandanas, publicly pleading for PPE supplies, setting up their own GoFundMe pages. The absolute chaos of it all. No ventilators, respirators. It was a harrowing 2 months, but it seemed the rest of the country would then have full time to prepare, but there was no preparation. Preparation in the US, is it really possible when there's no health infrastructure? Every state, every city, every county, its own rules and guidelines on testing, on shutdowns, on masks, now on vaccines. No coordination. It's the profit system at its most ruthless. And profits in the pharmaceutical and medical and health industries are at an all-time high. Closing of hospitals, there's mergers, there's layoffs. And all this, it isn't just the chaotic Trump administration. It isn't just racist right-wing ignorance. Will we have a bright new day now with Biden? Will we have mass vaccinations anytime soon? That's what we're evaluating tonight, because for one, I fear that the attacks will get much worse with the new Biden administration and a whole new crew of anti-China nominees. Look at the cabinet. The appointment testimony of the war hawk Anthony Blinken, nominated to serve as Secretary of State. It's one of many searing examples of a militarist stance. In his confirmation testimony, said on the war in Syria, US is not doing enough. On North Korea, unrelenting pressure, cut off all resources. He was for expanded deployment of missiles and surrounding and pressuring China from the South China Sea to missile batteries to Xinjiang province. And for new demands and continued sanctions on Iran, Venezuela, we should be really, really concerned. And then there's Kurt Campbell, who's appointed to the new position, National Security Council for Indo-Pacific Coordinator. He's considered the architect of Obama's pivot to Asia. So, and how does the media call him? By the most arrogant, really outrageous name. He's Biden's Asia czar. What a racist description. His role is to integrate an anti-China strategy and strengthen US alliances in the region. So we have a lot to take up tonight. We've all been assured that there was going to be a quick solution to this health disaster with the vaccine. We'll have to really see and think about that, especially from the view of who's hit hardest with the vaccine, who's hit hardest with the virus, and who gets the vaccine, and who will find it in short supply. So I want to open with asking Soo-Hin Lee, who's speaking to us from Shanghai, to please come on to tell us how conditions are where you are. Soo-Hin was in China last year, then he was here in Los Angeles for the first 6 months of this COVID virus, and then back in China for the last 5 months. So able to make comparisons and really tell us firsthand how things are in Shanghai and in China today. Thank you, Soo-Hin. Of the China-US Solidarity Network. I know Suhan was having trouble with his computer for the connection from Shanghai to here. Are you there, Suhan? If not, we'll go on and come back to you. Hello? All right, I think we'll have to come back. This was the interesting challenge, even in pulling this book together across continents and oceans, and yet so possible to do. So I'm sure we'll hear from Suhan in just a little bit. So let me ask the members of our panel, not sure who would, perhaps I can call on Margaret Kimberley on sort of our opening question, which is how is COVID-19 being weaponized, and what, if any, changes do you expect under the Biden administration? And we want to hear from each of our panelists, and then we'll go into a second round of questions.
I can't start the video, Sara. There I am. Hello, good evening, everyone. Thank you so very much for joining us this evening. I want to start by thanking Sara Flounders and Lee Soo-hin for putting together this anthology, Capitalism on a Ventilator. I'm very proud to have been included among the contributors. It was last January, it's just about 1 year ago, that we first heard of this new disease said to have originated in China. We didn't know much about it except that we knew it was communicable. And in February of 2020, the word severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2 came into the lexicon, and our lives have not been the same since then. It's an understatement to say that in this country, we had terrible leadership on this issue, particularly in the person of Donald J. Trump, President of the United States. He lived up to the worst expectations of his detractors, and he bears responsibility for the early response, which included a faulty test and an overall lack of urgency. But it's too easy to blame Trump alone. All we have to do is look at the rest of the world, how various governments responded and what the outcomes have been. At this time, there are more than 400,000 deaths from coronavirus disease in the United States. The federal government and state governments have lurched from assuring us that we were safe to then shutting down businesses and decimating the economy, only to reopen when big business wants workers to return. Cases rise and the cycle of indecision and incoherence continues. Americans are particularly vulnerable because many of them cannot access health care at all. It may be connected to their employment, but then they lose their jobs in the wake of the shutdowns. Or they never had it at all, as many so-called essential workers have experienced. These essential workers are less likely to have health coverage or to have the ability to work remotely and escape the risk of close contact. But in this nation, the patchwork of for-profit healthcare doesn't serve anyone very well. The best outcomes have come from socialist nations. Trump and even Joe Biden have blamed the Chinese government, at one point having a who can hate China more debate. But despite all of the negative propaganda, China told the world what we were dealing with by mid-January in 2020. China's had fewer than 5,000 deaths, and I am rounding up. No deaths there had been recorded for months, since last May until very recently. A recent outbreak is in the small hundreds of people, and China has responded once again as it did 1 year ago. They are building hospitals, especially for COVID patients, and stopping the spread. They have a tremendous capacity for testing, which has also stopped the spread. All of the nations with low case numbers have done likewise. The US and also the UK, which once had a robust public healthcare system, now decimated by austerity, have had terrible numbers of the ill and the dead. Biden comes to office promising to listen to the science. At the same time, he says that the trajectory of contagion is what it is, and we can expect to have 200,000 more deaths in this country. The non-system healthcare system hasn't gone away, neither has disagreement about how and whether to open schools and get people back to work. That has been the emphasis here, getting people back to work by giving them only meager amounts of one-time support. First, just $1,200, then $600, a promise of $2,000 by Biden, which has now morphed to just $1,400, and we won't see that for several months. The emphasis is the same: bail out big business and diminish anger with small handouts instead of giving ongoing support as many other countries have done. The term disaster capitalism comes to mind, but perhaps those words are redundant. Capitalism always inflicts disaster, but when a new opportunity arises to take advantage, the system always does so. It's though easy to make heroes out of people like Dr. Anthony Fauci, who now speaks publicly about his difficult experiences trying to work with Trump. But we can't fall back on cheap praise either, because someone is seen as a Trump antagonist. Fauci was among those who assured us we didn't need masks, only to reverse course months later and insist that we do. He says he and others were concerned that there wouldn't be enough protective equipment for medical professionals. That could have been handled with a dose of truth. But we live in a country with little to offer except capitalist predation, and the country that has been blamed is the one that produces the bulk of protective equipment that does exist. This is not about personalities. This moment is about systemic failure. If we didn't know it before, we know that the US is a failed state with the capacity to make guns, but not to help people. At the same time, Americans are still kept in the dark about advances in countries such as Cuba, where a vaccine is being produced, where treatments have kept the death toll low. In spite of continued sanction, that nation rises to the occasion, sending medical teams all over the world. It is countries like China and Cuba which show us the way. COVID has been weaponized to keep the rich rich and to keep the people under control. The system did not change because we have a new president. The US is still in for a long fight against COVID-19 itself and against the system, which is always used as a tool of oppression. Thank you very much.
Thank you so much, Margaret. Thank you. Let me ask also for our many viewers, if you have specific questions that you'd like to add, please do so in the Q&A and not in the chat, because we really won't be dealing with them there in the chat. So put any questions in the Q&A. And I see that Lee Soo-hin has been able to join us. So welcome, and let me introduce Lee Soo-hin from the China-US Solidarity Network. Thank you.
Thank you, Sara. Just like a Zoom conference call between China and US, and it could be chopping and sometimes even breaking. There's been many information what happened in China this moment. People in US are not getting from the corporate media. I back to Shanghai on September from Los Angeles at the first height of the pandemic in the US, and then I seeing the situation getting worse to even worse in US. When I'm in China, I getting better and life back to normal. But I want to say what is not just a luck, but it's what has been the country as a whole, a system, China as a socialism, and the determination to mobilize people to fight the virus, and also the determination from people across the country to believe in science, believe in determination that we can win this war, that made the why the China can beat the COVID and back to normal. So I want to say one good, since January, there has been scatter of the COVID happen across the country from north to south, also in Shanghai, where currently I am living. So I want to give some good example how I've been seeing, and then government has been responding quickly. Since 2 weeks ago, has been a city where I live, that's probably 2 miles from where I live, has found 2 people, and when they visit the hospital, they found the COVID patients, and then more quickly they launched just only even 2 people. They've been launching a very rapid response, mobilized roughly 3,000 medical workers and volunteers within overnight, and then they seal off where they live and the neighborhood, just a small part of the neighborhood, like it's an old town of the Shanghai, and roughly 10 to 15,000 people, and seal off the community within less than a few hours. And to once, then everyone, the 15,000 residents of this small neighborhood, need to do the test immediately within less than 2 days. Everyone done the test, and then they need government order the whole neighborhood need to be quarantined for 14 days, because it's our own neighborhood and then very packed neighborhood. So they quickly decided that they want to make sure that in a safe and humane quarantine. So they mobilize mobilize hotels, quarantine hotels, to housing almost everyone, thousands of people, to quickly move to the quarantine hotels for 14 days quarantine. So that everyone's highly cooperative, and then many volunteers and many community support, and that the whole thing run extremely smoothly. There have been the same thing happen from the north to south, that people are supporting each other's volunteers are coming very fast. All these medical supplies and the logistics are come very quickly, and then the spirit, specifically the spirit, has been very, very high. That's how China fight the virus. That's how community support the government to fight the virus, and then that's a reason why time by time, each time we can stop the spread of the virus to across the country. 3 weeks from now will be the Lunar New Year or Chinese New Year. It will be a year of ox. And because what the lesson learned from the January 2020, the human traffic across the country with asymptomatic patient could be a major potential disaster for spreading the virus. That's the reason now government is launching campaign across the country that asking people not to go into travel, and the Chinese New Year, just like Christmas, many people working on different city want to going back to their hometown for the holiday, and so they're convincing people across the country to this year stop going back to the hometown, stay at where they live, so that can be preventing the spread the virus. It will be it's that I'm talking about hundreds of millions of people now choose to stay in where they work and not going back to hometown to prevent the spread the disease potentially, because there's very few people in China now has the disease, but they want to make sure that even this small possibility or chance won't be happen. In compare with that's the reason why US and UK and many other countries during the Christmas period, they did not listen to government's warning and stay at home. They choose to going back vacation or going back to home for the holiday, and that's what happened to the latest surge and outbreaks of the mass outbreak of the virus COVID in US and Europe and the United Kingdom. That's the reason that the determinations and also trust in science and together we can fight the virus. All this ideology, all this thinking are different between China and many other countries, and also the political belief system in different why social systems can do it and capitalist system cannot do it. And I want to mention that recent outbreak of only a few hundred to 1,000 people across the country has been the worst since the last year. Almost all the cases can trace back from the import from outside the China, which just means that have been either the person coming back to China carried the virus and spread to the community. And according to the latest research in Shanghai area, the most travel foreigners have been carrying the virus back to China and have been detected at the airport was coming from US and Canada. Not surprisingly, because the US and Canada has a very high infection rate, but also they have been raising interesting and troubling questions, because right now the passengers, international passengers, need to have the COVID test before they can take a flight to coming back to China or many other countries. If they had took the negative test, how come when they fly back to China, they would test positive? That means raise a very important question that the COVID tests in US are not reliable, have been not reliable before and not reliable right now. That's the reason why the virus spread so quickly. And other things has been on Chinese media has been discovered, and the scientists has been talking about for months. Not only human transmission, but also have been issue of the COVID virus transmit through the packaging, the cold chain, you can also so-called frozen food from international shipment. Last couple months, the customs in China has been discovered many cases of food import from foreign countries, from fruit to ice cream to soda to beer to even a express mail, the packaging and meat has been found the COVID virus, or find the stain of the COVID. What that means that the workers could be working on the plant had the COVID and then contaminated the package and the food, and then because of cold chain and then shipped to other country and then spread the disease. That's the reason right now the customs in a different part of China that are now more focused on testing every shipment from foreign country, that if they carry the COVID. That have not been talked about around the world, and also need to be careful. Everyone need to be really look for that the packaging and the shipment has, if that's going, also the testing, all these things. Why? The capitalism don't care about the humans' lives. The workers getting COVID and still working, and then contaminate the food, and then the contaminated food and the packaging has shipped around the world. That's what have been happening on the meat industry in the US, and also have been Amazon warehouse workers, where tens of thousands of workers has been infected, and then when they're working, they contaminated the packaging, and this packaging shipped around the country and all around the world, and then infected the people. That's also we need. That's a Western media not talking about, and we should also looking into it. Thank you so much.
Thank you, Suhin. And there's a whole new area to really worry about, how even the packaging, even the Amazon, the meat packing can spread this virus. This is sort of incredible, and it is where science and cooperation come in. Let me go now to Vijay Prashad. Welcome. So honored that you're participating in this program and in the book, and you've written extensively on COVID-19, on the vaccine, on the China, on here, on around the world, India. That first question was, how is COVID-19 being weaponized, and what, if any, changes do you expect under the Biden administration? Welcome, Vijay.
Thanks a lot. I need to get permission to start my video. So, okay, there we go. Thanks. It's very good to be here. Thanks a lot. And I'm glad to participate with you all. It's been an interesting 12 months, 13 months really. I'm not going to talk much about the pandemic itself. I would encourage people to go also, apart from getting the book, to go to the website of the Tricontinental. We did 4 studies that I want to turn your attention to. The first was called China and Corona Shock, where my colleagues in Shanghai and Beijing and myself, we went pretty forensically through China's response to the coronavirus in order to dispel the racist, onslaught or the information war from the Trump administration. Not only Trump, but of course the man who was in the lead of this was Mike Pompeo. And so that was the first text I'd very much like people to see. We did a text on the issue of Venezuela during the pandemic. The most recent text we did, the 2 of them, one was called Corona Shock and Socialism, comparing the impact of government policy and public action as well in Vietnam, Kerala, Venezuela, and Cuba with the rest of the world, mostly the bourgeois governments in the world. And we found that in these countries, in Cuba, in Venezuela, Kerala, and in Vietnam, we found the 4 distinguishing marks of differentiation was that in these countries, governments took the science seriously. They didn't have a hallucinatory attitude towards what the WHO was saying. Secondly, they had a public sector that they could engage to produce simple things like masks, hand sanitizer, and so on, basically to break the chain of the infection. These societies also had public action. In many parts of the where bourgeois governments reign in the capitalist bloc, we see public action essentially commodified through the role of NGOs and so on. But in many of these other societies where there's a socialist process, we see public action. There are political organizations, there are trade unions, women's organizations, student organizations, but also, of course, neighborhood groups and so on. People have a very erroneous attitude of China, believing there's just a state. There's a great deal of public action, including neighborhood committees. And in Cuba, of course, the committees to defend the revolution. The role of public action was very important in breaking the chain of infection. And finally, the 4th distinguishing feature was that in these socialist countries, or at least in these places where there's a socialist project, we see the importance of internationalism, not a racist response, so that China, Cuba, they send doctors overseas. And this is the reason why I'd like you to visit the website of Cuba Nobel. Very important to fight to get the Cuban doctors of the Henry Reed Brigade the Nobel Prize for Peace for this year. Very important. That's half of what I want to talk about. I want to just raise two issues, put them on the table, because the question is asked, how will the Biden administration respond? And, honestly, on these two issues that I want to focus on now, the Biden administration has remained largely silent. So what are these two issues? One is what I think we should start thinking about as money apartheid. These are going to be two forms of apartheid. This is money apartheid. And the second is the vaccine apartheid. I'd like to put these directly on the table. And, it's interesting. Biden administration said a lot of things, including Antony Blinken, the nominee for Secretary of State, has said that Trump was right on China and so on. There's a lot of evidence of what they most likely will do. But on these two issues, on money apartheid, vaccine apartheid, they've been silent, which means they won't do much but just allow this to continue as normal, as most American governments do, if we're absolutely honest. What is money apartheid? Well, the central banks in the capitalist countries have opened the spigot. Interest rates in the United States are below zero. Money is being handed out to corporations basically with no consideration. They can just come to the window of the Federal Reserve and money pours out at them. Meanwhile, right now we see the external debt in dollars, but not only in dollars, the external debt of developing countries is somewhere in the vicinity of $11 trillion. Now, this is a perfect time for debt forgiveness. After all, there's $37 trillion sitting in illicit tax havens. So that's 3 times the amount of the total external debt of developing countries. This, pandemic situation like this should be immediately forgiven. It's not being forgiven. In fact, these countries are not even able to postpone debt payments. Right now, we estimate that by now another 12 or so months, the total debt servicing coming from the countries of the developing world will be about 3.9 billion. That's 3.9 billion to service the debt of 11.7 roughly trillion dollars. So sorry, $3.9 trillion to service the debt of about 11.7 trillion. This is going to be demanded of these countries in the next 12 months and thereabouts. 60 countries of this block of 122 odd developing countries, half of them are paying more to service their debt than for healthcare in the middle of a pandemic. This is money apartheid, because half of the countries of the developing South are spending more to service the debt to the northern banks and to bondholders, wealthy bondholders, than to pay for healthcare in the middle of a pandemic. Meanwhile, central banks in the West are opening the spigot for their corporations. So the first thing I want to put on the table is money apartheid. The second one, of course, is vaccine apartheid. The head of the WHO said recently that there's a catastrophic moral failure in the world. It's very strong words he used, catastrophic moral failure. Because frankly, most of the world's population, 3 to 4, maybe 5 billion people, may not see a vaccine till next year, maybe the year after that. I mean, in the West, people are complaining vaccine rollout has been slow and so on. Okay, fine. Vaccine rollout has been slow. But in many parts of the world, they will not see a vaccine. They may see it in 1 or 2 years, by which time, who knows what's going to happen. So Tedros quite rightly said there's a catastrophic moral failure because vaccine nationalism pushed by the wealthier parts of the world, this vaccine nationalism is going to really destroy any equitable vaccine delivery. I have to say that underlying this vaccine nationalism is about 50 years of the destruction of public sector pharmaceutical industry around the world. By the way, this includes the Clinton administration's bombing of the Al-Shifa pharmaceutical factory in Khartoum, Sudan. You may remember this. They said it's a chemical weapon plant. It's the only pharma industrial plant in Sudan, was bombed by the Clinton administration, never rebuilt. So that's just a terrible example, but there's been an attrition of pharmaceutical production in the developing South because they've been told, well, buy drugs elsewhere, or if you produce them for the global commodity chain. So countries like India will produce the vaccine, but they'll be gone to another country. They cannot vaccinate people in India. So the second issue is a vaccine apartheid, which has come into place very strongly. And there seems to be no exit from this. So, Sara, to your question, Biden administration, this, that, and the other, they may do a lot of things that are better than Trump. Maybe, I don't know. I'm not interested in that right now. What I'm interested in is in these two key issues for the survival of billions of people around the planet. The question of the external debt of the developing countries amounting to 11.7 trillion and the lack of access to vaccines. These two issues, on this, the Biden administration is silent. It will do nothing. It's going to allow this apartheid to continue. It's going to allow essentially the same sort of north-south policies to be in place. And I think for this, there needs to be a lot of noise made around the world in order, to overcome the catastrophic moral failure. That's the phrase Tedros used, the head of the WHO. It's a catastrophic failure. He said it in context of the vaccine. I think that's too limited. It should be said there's a catastrophic moral failure in the context of the vaccine and money. Money. I want to repeat this and then I'll leave you. I want to repeat this. 60 countries around the world are spending more right now to service debt to wealthy bondholders. They're spending more on that than they are spending on healthcare in their own societies. Thanks a lot.
Wow, such a damning indictment. Thank you, Vijay. Catastrophic moral failure. And along with money apartheid, we have 39 countries, a third of the world, sanctioned and cut off from any of the medicine and aid and assistance they desperately need. Vaccine apartheid. Let me bring in Max Blumenthal and addressing the same question, which you've very much been dealing with in Gray Zone. So, Max, welcome.
Thanks a lot, Sara. Thanks for inviting me to this webinar. And it's never been more timely to have this conversation. I guess I want to talk about some of the work we've done over the past year, specifically on Latin America. So much of what we do at the Gray Zone is related to combating the information wars that the West, and specifically the United States, through the State Department and its force multipliers, wages on countries in the global South that are targeted for regime change because of their independence or their socialist economic systems. And the pandemic has created opportunities for the US and its media stenographers to amplify this information war, specific countries in the Western Hemisphere and Nicaragua. And we've had opportunity at the Gray Zone to visit and cover elections in Venezuela, recently the legislative elections that took place this winter, and the basically reversal of the Bolivian coup took place in October. In two countries that were, one country that was hit disproportionately hard by COVID-19, and another country that has been hit particularly hard by the US information war related to COVID-19. And the information war is just one part of the hybrid war that the US is waging around the world, most strongly and forcefully against China, which I guess is the main source of this conversation. And I guess I'll end. I would really encourage everyone to go to thegrayzone.com and read or watch my interview with Venezuelan Vice President Vijay, who is not only in charge of the new anti-blockade law and new mechanisms for circumventing the effects of the US economic blockade, but also has overseen weekly briefings on the pandemic, various experimental protocols that Venezuela has put in place. And so you can hear her remarks for yourself as she details what they did on the ground as soon as they were aware in Venezuela that a pandemic was on their hands. And that awareness arrived much more rapidly than it did in the United States. This was heaping scorn on China and specifically the city of Wuhan for the lockdown measures it painted as authoritarian and draconian. Venezuela's president, Nicolas Maduro, had just returned from a trip in January. And as soon as he learned about what was happening in China from his partners in the Chinese government, he coronavirus task force in Venezuela. Within days or weeks, Venezuela began a national campaign of monitoring symptoms. And then within that pool million, they began to implement testing. And they received testing kits thanks to their close relationship with Russia and China more rapidly as aligned nations in like Colombia, for instance, right next door, which has been hit especially hard by COVID-19. Through the testing, Venezuela then began isolating citizens in hotels who had asymptomatic symptoms or put them in public hospitals, face symptoms, and began treating them as much as they could. And the virus spread this summer in Venezuela because so many people were coming back from the upper classes, the middle and upper classes who are supported from places like Italy that were hit very hard by the pandemic. And so measures were put into quarantine people coming back in who were bringing the virus in, or who were coming back across the Colombian border, or from places like Ecuador and Brazil, where you had US-backed governments that were basically doing nothing. And the New York Times comes in and writes these stories being put in concentration camps, relying on anonymous residents of these quarantine facilities, hyping up the most, disturbing news possible to paint Venezuela as this gigantic failure. And of course, hoping for social chaos as a result of the pandemic, which never happened. CNN, while I was in Venezuela with Anya Parampil, covering the legislative elections, which were fraud without any evidence by U.S. Secretary of State Mike Pompeo, CNN sent one of its State Department stenographers in, a correspondent named Asa Suarez, who is, an upper class Latin American like everyone else at CNN who covers the continent. And she produced one of the most propagandistic pieces I've ever seen about COVID-19, which presented harsh images from a dirty public hospital and interview with a doctor who said that Venezuela was conducting a gigantic cover-up of its statistics and that everybody was dying and that people were afraid to get involved in the system of treatment and isolation. What she didn't say was that doctor was named Ricardo Villasmil, and he was the head of Juan Guaido's COVID-19 task force. And basically his job was to propagandize with a stethoscope around his neck against the Venezuelan government. So giant omission there. The piece barely profiled the hotels and facilities that Venezuela had set up for people who were tested and were asymptomatic. And then one other thing CNN neglected to mention in this report, which you can actually find on CNN's website elsewhere, is that according to CNN's global tracker, which is based on statistics maintained by Johns Hopkins University, you just go to the interactive map on CNN.com tracking coronavirus's global. Venezuela is at the bottom globally of cases per 100,000 citizens, with 0 to 829. Of course, the countries that are at the highest
that's
are the
that's
ones
news
that
to me.
are home to. CNN is the one that is home to CNN's broadcast facilities. So the information war was also waged. The Washington Post proclaimed that Nicaragua, this is in April, was doing nothing to combat the spread of the coronavirus. That was because Nicaragua had a very low number of cases. And the photograph that was beneath the headline on this article about a caravan, an educational caravan, that the Sandinista party, the governing socialist-oriented party of Nicaragua, was to neighborhoods across Managua to educate people about this new virus, which they knew nothing about, why they should be washing their hands, sanitizing, social distancing, wearing masks, and so on. And they said that that caravan was actually threatening people and spreading the virus. The reality was that was the last Sandinista caravan of many every week. And it hadn't actually, it was, the photo was taken 2 weeks before. So it was a complete lie, but it was also what the government was doing. And what was also left out was that the right-wing opposition in Nicaragua, which hails from the upper classes, was spreading, using Facebook to spread misinformation about school closures and trying to use the virus to spread complete social chaos across society. You have an interesting phenomenon where much of the economy exists in the informal sector. I mean, this is across Latin America, a key factor in understanding these administer their protocols. The Sandinista party's base is in the informal sector. These are vendors. These are people who are subsistence farmers, campesinos. They live day to day. And so how can you put them under lockdown in a very poor country? It's very difficult to do so. And so Nicaragua had to flexibilize its response, as Venezuela does. Venezuela has a flexible response where it will allow people for a week or be out in the street for a week or two, and then there's 2 weeks of lockdown. Nicaragua tried to limit the lockdown until many people started bringing the cases in from the out, and later in the summer, the lockdowns got a little more serious. But Nicaragua has been able to do, just like Venezuela through its CLAP program, which provides practically free food and free sanitary supplies, is to actually provide for citizens through its public health care system, which we don't have in the United States, and through various hunger relief programs, free food, things like that, to allow people to not work. Meanwhile, in Colombia, we ran an article on this at the Gray Zone, an on-the-ground report by a reporter named Nash Landsman. Families who were put under lockdown were actually hanging red flags out of their windows to indicate that they were dying from starvation because they were provided with no relief in this country, which is trying to follow World Health Organization guidelines, but isn't providing its citizens with any relief at all. It was the same across the Northern Triangle in Central America, where—
Thank you for the follow, Goat.
Nayib Bukele from El Salvador, Juan Orlando Hernandez, right-wing US-backed leaders were basically sending arms carriers into markets and tear gassing people who kept working during the lockdown. Guatemala declared emergency law, and people were forced to stay at home with absolutely no assistance at all. In Bolivia, in fact, the right wing did absolutely nothing. I really recommend everyone check out our report by Ali Vargas.
Man, his volumes are—
works at Causachun News.
Come on, Max.
Is the official news agency of the Coca Growers Union in Bolivia, and he reported on how people in the tropic region of Bolivia ate to herd immunity because the government did nothing. All the industries and the public health system basically collapsed, and so they were turning to traditional indigenous eucalyptus and things like that to treat themselves. They've just wiped out anybody who was vulnerable. Contrasted that response with the response of Cuba, which has now appeared to have developed a vaccine. Our media has not conveyed this reality to us. Instead, it's basically using its power to amplify what is a warlike response to COVID, exploiting a pandemic to weaken further states that are targets of regime change. And what we've seen is that they've failed, just as they failed sanctions, just as they have failed with the coup attempt in Venezuela. And here's where I want to point to Biden's expected response. It's pretty clear to me that the Biden administration, based on statements from National Security Advisor Jake Sullivan, Secretary of State Tony Blinken, and others in the administration, want to use Trump's sanctions that he's piled up on countries like Venezuela or Iran, towards Iran, or the various hostile policies applied towards China as leverage. And they don't want to get rid of that leverage right away, getting under a kind of delusion that the world is the same as the one that was left to Trump from a left office. And what they fail to understand is that these countries, through their experience with Trump and the intensification of hybrid warfare, have developed new mechanisms, economic, social, and military, new weapons to combat the effects of hybrid warfare, are more independent, are more sovereign, and are more able to fight back. The Biden administration continues this hostile policy. And in that sense, there is hope. That's the end of my comments. Thanks a lot.
Thank you so much, Max. And I now want to bring in Margaret Flowers, who I want to ask her to take it from here. But so many points that have been raised, I think, just show two different approaches, one based on social solidarity, on cooperation, on science, on having a view of the world, and then what we're faced with here, which is a crisis here and spreading it around the world. So, Margaret, let me hand it over to you. And I just think you have so many insights on this as a doctor, along with with Popular Resistance, with the radio program, and so much commentary, but a very personal feeling on public health.
Great. Thank you so much, Sara. And thank you to all of our panelists for that first round of responses, and to all of the participants for being here today. So as Sara mentioned, I'm a medical doctor, a pediatrician. I practiced for 17 years, but it's been a few years now since I have practiced. But I just wanted to start out this portion of the program where we're going to go into the vaccines a little bit, that vaccines are a fundamental tool for public health. And if we really want to get this disease under control, as we have with so many other infectious diseases, it's critical that we have effective vaccines and that we get these out to the people so that we can start to build up an immunity in the population that prevents the spread of the virus. And we know that we need very high rates of immunity, 70, 80, maybe 90% immunity to really curtail the spread of this virus. So I want to remind people that the virus that causes COVID-19 is a new virus. We're still learning a lot about it. And one reason it's so important to get it under control is that some of the things that we've seen so far show that, this is a very serious situation. For example, in children, they have been finding a condition similar to what we know as Kawasaki disease. It's an inflammatory condition that children have been having because of being infected with COVID-19, and this causes impact on the heart. And so this is serious, for young children, and a serious risk for them. We're also seeing people who develop what's now becoming known as long COVID. So these are people who continue to have symptoms for months on end after becoming infected with COVID-19. And then finally, we're seeing in adult population chronic disease as a result of infection with the COVID-19 vaccine. So inflammatory heart disease, kidney disease, liver disease, diabetes mellitus. So in fact, there's a new study that's come out of the United Kingdom. It hasn't appeared in a peer-reviewed journal quite yet, but just looking at the numbers, what's interesting from it is that they found that 30% of the patients who were hospitalized with COVID-19 were re-hospitalized within 5 months with things like heart disease, kidney or liver disease, and 1 in 8 of these patients died. This is following their infection, so they're no longer infected, but they have these ongoing impacts. So they estimated there was a 3.5 time greater likelihood of someone dying after they've been infected with COVID-19 compared to the population, a similar population that was not infected with or the virus SARS-CoV-2 that causes COVID-19. So for this reason, it's really important that we continue to try to get a handle on this virus. The more that it spreads, the more likely it is to mutate. We're already seeing mutations. This is a typical event with viruses, but it can mutate in ways that we can't predict, that can cause things that we don't know what they're going to do. We've already seen mutations that are causing it to be more infectious. It could become more lethal. It could also become less lethal. We don't know, but it's a risk that we take the more that we allow this to proliferate in our communities. And so as long as the virus exists somewhere in the world, it puts the world at risk that it can, break out to other areas and spread. Excuse me. So for this reason, it's really critical that we have this global cooperation, this global solidarity, sharing of information, sharing of resources to try to get a handle on what is really a very global problem. And to that effect, on using the World Health Organization, 190 countries have come together and created what's called COVAX, which is a mechanism of storing doses of COVID-19 vaccines. And then of those 190 countries, I think there are 92 countries that are low or middle income who qualify to get access to these vaccines. And of those 92, 86 have already submitted plans for how they would distribute the vaccine to their population. So this is a really critical structure to start to deal with this vaccine apartheid that Vijay mentioned. And under the Trump administration, the United States left the World Health Organization. The Biden administration has now re-entered that. This is a positive step, I would say, with one caveat. In the directive about rejoining the World Health Organization, the United States talks about wanting to take a leadership role and reform that institution. That always makes me a little bit concerned when the U.S. wants to be at the leadership of these. I think it really needs to be a shared leadership, and recognizing that other countries like China that have a philosophy of the global good that's contradictory to what the United States typically does when it's involved in the leadership of these institutions. And I just wanted to quickly mention that, after this outbreak of the pandemic, we did see many countries coming together and cooperating. Countries like Cuba sending the Henry Reeve Medical Brigade physicians out to assist. China sending supplies to so many countries sharing what they had. At the same time, what the United States was doing was escalating military aggression, escalating unilateral coercive measures to make it more difficult for other countries to be able to purchase medications, supplies, food, all those types of things. And I wanted to mention that in the Biden administration executive orders, there is language about looking at the sanctions to determine whether they've become a hindrance to countries being able to deal with the pandemic. And that looks like a good thing, but if you look at the language that they're using, it may be that the United States can say, oh, well, we've looked at these sanctions and we don't think they're actually having an impact, so we're not going to change anything. So we need to really be pushing the Biden administration to end these illegal economic coercive measures that are causing deaths. We've documented that there are studies, they're causing deaths in these many countries. So I just wanted to look at a little bit again of how the United States has responded through this past year to the vaccines that are being made, this kind of vaccine war. And in March of this year, or of last year, we remember that the US government tried to purchase the rights to the vaccine that was being produced by a company in Germany called CureVac. And the reason the US wanted to buy the rights to that is so that the US could make sure that the US would have it, not necessarily to share with other countries. That was stopped. The German government stepped in and said that wasn't going to happen.
Nice.
In May of last
Nice.
year, John C. Demers, he's the Assistant Attorney General for National Security, was putting out a strong message saying, oh, we have to be very afraid of China. China's going to try to steal our intellectual property for their own vaccines, our research.
God.
And so alert, watch out for China trying to steal our research. And this is part of that hybrid war, that information warfare against China. In June of last year, the United States refused to collaborate with China on the research and development of vaccines. This is unprecedented. When the United States was in a Cold War with Russia, they continued to collaborate on issues of global concern, and in fact, even around the eradication of disease, particularly smallpox and malaria. So normally when there are breakdowns in relations between countries, there's still this sharing and collaboration when it comes to these global problems. And then in August, when Russia announced that its vaccine was going into clinical trials, there are all kinds of headlines in the United States saying, all kinds of things about Russia and questioning their integrity of their vaccine research, and would you trust a vaccine that came from Putin? In fact, I saw circulating on social media all kinds of really
Putin, the devil,
horrible
the devil
types
himself.
Of jokes, saying that, if you take the Russian vaccine, you're going to start speaking Russian. I mean, it was just like really
take the vaccine,
propaganda
you're going to start speaking Russian.
Russia, and in fact, the United States did sanction
Wow.
Russian institutions that were involved in the development of that vaccine. The United States has developed now 2 vaccines, the Pfizer and Moderna vaccines. These are both using new technology, the mRNA technology, and this requires the vaccines, well, particularly the Pfizer one, requires very extreme cold temperatures in order to be stored. And so this limits how well this can be distributed, both in the United States, particularly our rural hospitals that don't have infrastructure, but very much around the world in countries that are less developed than the United States. What we see in China and in Russia with their vaccine production is it's more using the standard technology of inactivated viruses or using adenoviruses to convey the genes to produce the proteins to develop an immune response. And these vaccines are much more stable. They don't require these high temperatures, and so they're much easier to distribute. So, just a difference there in the technology makes a real difference in the availability of those vaccines. So I think with that, I want to stop my comments. We're running a little bit over time. Yeah. So I did want to give our panelists time to quickly respond about the vaccine, and hopefully we can get a few questions in. But I know in particular, Soo-Hin, you wanted to speak about the vaccines in China and what you're seeing there. Go ahead.
Margaret, can you hear me?
Oh, his audio is horrible.
Let me try to
turn your video off so your audio sounds better.
The vaccine right now, China has
fuck.
Soo-Hin, you're breaking up a lot. Maybe if you turn off your video, let's see if that works better.
Yes. Yay.
Okay, sure. Let me try. Yeah, can you hear better?
Oh yeah.
Yes, much better.
Oh yeah.
Okay, sure.
Oh yeah.
So right now, over 20 million people have been vaccinated. Of course, China has 1.5 billion people.
Damn. I'm gonna blame the CIA on this. Close your browsers. Lee. Close everything, but
the government forecasting that by March another several tens of millions of people will be vaccinated, and that's the one that putting the fastest and most comprehensive vaccination program in the world. And in comparison with what happened to chaos and in Europe and the US, one thing is really clear that public support of the vaccination are very high, and there's been a very specific priority. So first, medical workers, and the second priorities has been cold chain workers and the docking workers, which is I mentioned earlier that many imported products has been found the COVID strain, and so that the docking workers, transportation workers, and all these cold chain workers are also the top priorities. So that has been working very smoothly. Also, the public support are very high, and there's very few people except the far right in China.
Now, my camera's out now? What the hell?
Other than that, most people support the vaccine.
What the hell?
And also one thing, and despite
what is going on here?
Western and U.S. propaganda about the vaccines, over 20 countries have been ordering the Chinese vaccine, and China have been showing the international vaccine solidarity by providing vaccines from Europe to Middle East to Africa to Asian countries, and several head of states from Turkey, from United Arab Emirates, to Egypt, to South Africa, to Indonesia. Like the Indonesian president just took the Chinese vaccines. So total another several dozens top government officials and also the head of the state have took the vaccine, Chinese vaccines. So the trust in the Chinese vaccine on many developing countries and many parts of the world, even wealthy nations such as Serbia and UAE has been re-endorsing and supporting the Chinese vaccines. That has been happening on what the U.S. and European country has been a so-called vaccine nationalisms. Either they're not sending the vaccines or delaying the shipment to those countries, or they're using that as a weapon to blackmailing those countries from some kind of political concessions.
Great, thank you so much, Soo-Hin, for your comments. I'd like to ask if there's anybody else from the panel who would like to respond about the vaccines and the different philosophies between various countries on the vaccines and how that's impacting the global health. Margaret, did you want to say something?
Yeah, just very briefly, somebody once said that the business of America is business. I can't remember who said it or when, but that's certainly true. We know that these vaccine makers are going to make a lot of money. Moderna and Pfizer are first out of the gate with these emergency use authorizations. But we're seeing with the vaccine rollout what we've seen all along this past year. Excuse me. First, we were told only certain people should get the vaccine and we're saving it for them. Then we hear that vaccines are being thrown out, and it's a problem that it's a 2-dose process. Here in New York, where I live, supplies are very low. But the vaccine race is happening all over the world. Countries we've mentioned, China, Russia, Cuba, others have their own vaccine. But once again, we're not told that they exist. Their efforts are ridiculed. China agrees to help poorer nations. We're told to be suspicious of them. The United States isn't helping anybody else, of course. But we always have to be concerned about the role of the big pharmaceutical companies. Once again, healthcare is subordinated to the profit motive, and these companies have no limits on how much money they can make. And instead of having this hands-off approach, the government needs to be telling them what to do. But that's the way things should run. But unfortunately, they do not. And so I would say that is what we need to watch. We need to watch these pharmaceutical companies. We need to see if the Biden administration will be different. Not that much, I don't think, because the role of these corporations remain the same. So that is my concern about the vaccine, and also about safety. It appears that there have been some adverse reactions, but largely there have not been. But I don't think people should be dismissed and sneered at because they're hesitant to use these vaccines that have been fast-tracked.
Good point.
As some of those fears are diminishing, as the number of cases continues to grow. But those are the issues that I'm interested in with the vaccine. Thanks.
Thank you, Margaret. Vijay, did you want to make a comment?
Yes, I'm just going to make this comment, then I have to leave, unfortunately. But I wanted to say
He's a
that
busy
the
guy.
reason I brought up
He's
money
everywhere
and
these
vaccines together is that countries are being forced to pay their bondholders for debt servicing with money that they could use to buy vaccines.
Exactly.
Right now, the other phenomena which I'd like to put on the table is what some people are calling vaccine hoarding. So, for instance, Canada is actually the biggest scofflaw here. Because the Canadians have bought enough vaccines to vaccinate each Canadian 5 times. That's not necessary. You know, there's the vaccine and then the second vaccine. You don't need 5 shots, 5 jabs per person. But that's what the Canadians have done. The numbers so far show us that 14% of the world's population, that is the people in the richest countries in the world, the imperialist bloc, 14% of the world's population has now purchased effectively 53% of all available vaccines. I mean, this is all prior to the problems of the cold chain. You know, the Pfizer vaccine requires storage at 70 degrees below Celsius. That's very hard for most countries to do because they just don't have the cold chain. But even before issues of the cold chain come in, you've already seen vaccine hoarding take place. And I want you to consider that Canada, which has this grotesque reputation for liberalism, has just bought 5 vaccines per head, which they don't need. They only need 2
for
per
liberalism.
head, and yet they have bought 5 per head. Let me ask you, why
you
do the
hit that on the
Canadians
head,
need
Rad.
5 vaccines per head when there are countries in the world where they just will not be allowed to buy them? Because these same countries, Canada, United States, etc., are going to insist that they service the debt. When that money, which these countries have, they don't need bloody charity. They don't need philanthropy. They just need the debt to be totally cancelled, you know, and set the clock at 0. If a wealthy banker goes bankrupt, they set their clock at 0 in terms of through bankruptcy law. But countries like Zambia, Argentina, Lebanon, simply not allowed to bring their financial clock to 0. They are being penalized. This is a war against these countries, an economic war. These countries don't need charity. They don't need your sympathy. They don't need any of that. They produce their own wealth. What they need is the debt to be immediately cancelled. Those who are going to fight against vaccine nationalism, to fight against vaccine hoarding, it's not enough to do that. You have to also fight to cancel the debt in total. $11.7 trillion totally cancelled. If you just fight against vaccine nationalism and vaccine hoarding, you'll end up in a kind of charity sphere. Let's find a way to get these countries vaccines. These countries don't need your charity. They need your solidarity. And your solidarity has to be demonstrated by fighting to cancel the debt in sum. Thanks a lot for having me tonight. Thanks, guys, for the book, and congratulations.
Thank you, Vijay.
Thank you, Vijay. Thank you so much for taking time to be with us.
Bye.
Max, did you have a comment about
I feel like Alice
vaccines?
Brady here. I'm in the middle.
Well, I don't know if it's been mentioned, but I think a good microcosm of apartheid that Vijay mentioned is the policy of apartheid Israel towards all Palestinians living under
the Palestinians aren't
occupation, which is to deny them vaccines while Israel is touted as a global leader in providing vaccines, which it has received more of or per person per capita than the United States government or the United States than our country. This is just textbook medical apartheid.
Medical
Israel
apartheid.
has military
Medical
control over all Palestinians in the West Bank. 300,000 Palestinians in East Jerusalem have no citizenship either. They are residents technically of Jordan. And then you have 1.8 Palestinians living under siege.
1.8 mil.
None of them have access to the vaccines, which are being rolled out at a very rapid rate to the Israeli population. Many of these vaccines, by the way, were acquired through mysterious means by Israel's intelligence service, the Mossad. So I look at Israel not as a uniquely, but as a depiction of the most severe image of the West. And as Vijay mentioned, there is a oversupply of vaccines for countries that represent 14% of
That's
the world's
amazing.
population. The global
14%.
North, partly with the fact that the US and have resisted a patent pool which would allow for vaccines to be rolled out in a more public fashion to global South countries. And therefore, Pfizer has sold 80% of its vaccines to 14% of the world's population. Then you have a situation where Oxford University produced a vaccine, COVID-19, early on. It wanted to put this vaccine on, make it the public good, just publicize the vaccine and allow countries and anyone who could produce it to do so, start getting this virus under control globally. But the Gates Foundation of Bill and Melinda Gates stepped in, encouraged Oxford University researchers to privatize the vaccine and sell it exclusively to the big pharma giant AstraZeneca, which it did. The researchers stand to make an enormous profit, as does AstraZeneca. And the EU, result of this privatization, has a shortfall in vaccines produced by that company. So thanks to Bill Gates and Melinda Gates, there's been a public health failure, and this is the agenda.
Yeah, it's
Bill
the
Gates
agenda.
is to privatize global medical systems,
Privatize.
to turn out massive profits for the big pharma industry, whose former directors and apparatchiks occupy many board member seats at the Gates Foundation. This is a really dangerous agenda. Bill Gates is an enemy
Of the people.
of the global population.
There you go.
And the media, which
There
he's
you go.
literally
Enemy of the
paying,
people.
spending tens of millions of dollars a year to fund media, including on entire Guardian, is painting him as some heroic saint who's absolutely altruistic and wants to do nothing more than save the children of Africa. Several months ago, I guess about a year ago, there were people who were branded psychotic conspirators for bringing up the possibility of vaccine passports.
Yeah.
The
Unbelievable.
idea that only people who would be able to travel or receive certain public services and go out into the world, see that vaccines are being administered or made available to a privileged portion of the world's population, continuing to discuss, and even the EU is beginning to discuss, imposing passport restrictions whereby people are refused entry to countries and public places unless they can provide a passport proving they were vaccinated, which is necessarily discriminatory. That's the world we're entering, and I think based on this discussion, there is a better way, and we have to move to resist this. So anyone who put on the talk, thanks to Sara and Margaret especially, and it's good to see everybody virtually. I hope we can all see each other today. Who knows
Thank
when that'll
you.
be?
Yeah, who knows when
Thank
that'll
you.
be.
So I do want to take just a minute to address some of the questions that have come up in the Q&A,
chat, yeah.
and a number of them are kind of more
I put a
medically
few in there
oriented.
for us.
One asked about the technology of the Chinese vaccines, and as far as I know, there are 5 vaccines currently, I think, being tested in China. One is an inactivated virus, which is a pretty typical technology. If you think of the injectable polio vaccine, it's an inactivated virus vaccine. And then the other 4 are using adenovirus, and it's where they put genes from the SARS-CoV-2 virus into the adenovirus and get it to produce the protein, the spike protein on the SARS-CoV-2 that seems to be the one that, when you induce immunity to that, is effective. So those are very traditional technology. The Russian vaccine is also an adenovirus vaccine. And I forgot to mention that Johnson & Johnson in the US is now seeking approval, FDA approval, for their vaccine, which is also an adenovirus vaccine. So none of those vaccines are mRNA, just the Pfizer and Moderna are mRNA, and that's a brand new technology. Someone asked about, if you only get 1 dose of the vaccine, are you protected? Right now, most of these vaccines are 2-dose, and it depends on which vaccine you get, but the numbers I've seen with the Pfizer is if you have just 1 dose of Pfizer, you're about a little over 50% protected. So what people are recommending is that if you only have 1 dose of vaccine, that you should continue to consider that you can be infected, and that you should continue to protect yourself, wearing a mask and doing the other precautions that we're taking. Someone asked about the length of immunity, and the reality is we don't actually have an answer to that yet fully, because it hasn't been that long. So it's something we definitely need to monitor, because typically with coronaviruses, we don't see long-lasting immunity to that. So we'll have to see with this 2-dose regimen how long that immunity is going to last. Someone brought up the adverse reactions, and I just want to remind everyone that every vaccine causes adverse reactions in certain proportions of the population. But the reason that we use vaccines is because if you look at the benefit that you get from immunizing the population and stopping the disease, which has its own impacts on health, is generally viewed in most situations to outweigh the fact that there will be some adverse reactions and even deaths to some of the vaccines. But those numbers are small in comparison to the number of vaccines that are delivered. Someone asked about the mechanism of these kind of chronic disease with COVID. I think that was the question someone asked about blood clots. And I think what people are finding is that SARS-CoV-2 is not so much a respiratory disease as people thought initially, as it's actually a vasculitis, an inflammation of the blood system or the vascular system. And that's why you see the impacts in the lungs, the heart, the kidney, the liver, the brain, and even the pancreas with insulin production. It's from these vascular effects. And then someone asked about ivermectin as a drug for treating COVID-19. What I've been using in terms of looking at recommendations for treatment is the Eastern Virginia Medical School has on their website a COVID-19 treatment protocol. They're constantly updating it. They're looking at the studies. It seems to be really excellent, and they have added ivermectin. If I recall, they were recommending it for exposure and for mild disease, but not for severe disease. But there's a whole protocols there based on the severity of the disease, and which I have looked at and seems to be fairly reliable. And then someone asked about information on China, and I think that Vijay Prashad's website, the tricontinental.org, as he mentioned, those various dossiers that they've done is excellent. You can check out thegrayzone.com, also check out blackagendareport.com. These are all excellent places to find information, and as well, of course, popularresistance.org. We try to keep things up to date there too. But and then the Chow Collective, I highly recommend. It's QIAO, the Chow Collective. Provides information on what's happening in China. And I don't know if Suhin has other recommendations.
Yeah, the Chow Collective is great.
Information about China.
I used some of their information on stream last night.
Suhin, did you want to add to that?
Yes. Yes, Margaret. I would say that right now the translation is the issue, but if people want to going to find some more medical information, I would say they're going to check some of the Chinese English media, such as the Global Times. So it's the Global Times .com.cn. And that is if you go into Google search, it's easier. It's a China Global Times. That's been many latest report, but also a treatment specific. Also China Daily. If you're going to check the Google, you can find China Daily. It's not just only the news, but also I want to raise one more issue that traditional Chinese medicines as an alternative of the treatment has been very helpful on fight the COVID, especially what happened on the Wuhan treatment last year. There has been many traditional Chinese TCM doctors has been using the traditional method to treat the patient, have been worked very, very well. I'm in China, and I see that there's also has been a different way to treatment. But the most important thing is not just only looking for Western capitalist corporate hospital system treatment option, but also look for alternative and options, not just only from China, but also from Cuba that have been worked really successful.
Great, thank you so much. So we've run out of time. Sara, did you have any final comments that you wanted to make?
Of course.
I just want to say this is the exact hope in producing the book and doing the webinar tonight. How do we have our own voice and not literally be just held captive, pulled along by the propaganda, which is whipped up against China, and also whipped up in terms of this medical catastrophe in ways that terrify people. We want to show that there is a scientific approach, and also that socialist cooperation and coordination can, even something like a virus, make it at least containable and controllable. I thought, Margaret, what you raised on the difference in the two vaccines is very important. The US has chosen a route which is a high-tech, patented, have to keep it super cold, only limited amount can be produced and produced over the next 6 and 9 months. And China and also Cuba and Iran and Russia and a number of countries are producing the low-tech vaccine, which is a standard well understood around the world. And it's being hit with a lot of propaganda from the US. Oh, this isn't as effective.
Sure.
Well,
I wouldn't believe
the
goddamn thing the government, U.S. government says.
And China and also Cuba just committed to getting out 100 million doses. This is a country
100 million.
A population of only 11 million. So they're willing to produce for the world and provide the doctors and technicians. Vietnam has probably the lowest in the world of COVID cases, just because they made it a national campaign, like their liberation struggle, to be free of this disease. So I think we want to learn a lot from the countries that really have something to teach beyond fear, superstition, racism, backwardness, the idea of not wearing masks. Who cares about your neighbor? The idea of not providing vaccines
yeah,
to
me
the
too,
world.
Jose.
Who cares about your neighbor? It's all just for money. So I think we really wanted to and hope to continue a discussion as to how cooperation, and I'll say also in closing on where more information, so much information on popular resistance.
Mm-hmm.
I write for workers.org. And also material on International Action Center, who helped in producing the book. I think Suhin Lee made excellent suggestions that Chinese media, it's not hard to find on Global Times and CGTV and so on. Black Agenda Report has articles all the time. The Gray Zone and Tricontinental. There's a lot of material out there, and the more people are reading and thinking about this, that's what we hope to accomplish. So thank you, to this whole panel and to an approach an approach to say we can understand this and we can learn from it, and we're not going to be just pulled in tow to another
Low
war,
observable goat, you
more
are welcome.
sanctions, to less vaccines. So forward science and socialism and cooperation.
Thank you.
Nice.
Thank you, Sarah.
Nice.
So you can buy the book at, the link is bit.ly, bit.ly/cap vent book with a capital C, a capital V, and a capital B.
Put it in the chat.
Or you can buy it at bit.ly/cap vent ebook to get the e-copy. It's capital C, capital V, capital E, and capital B. So, or just Google the title and you'll find it. So thank you very much, everyone, to our panelists for being here this evening, and to all of the participants for staying on a very long webinar. And you can find recordings of this at the Popular Resistance Facebook and YouTube channel if you'd like to share it out or watch it again. So thank you, everyone, and good night.
And soon on Free Speech TV, I think, also.
That's right.
And Twitch. Don't forget about Twitch.
To that.
And thank you to A-Bear for sharing this on Twitch.
And Twitch. Thank you.
Thanks, everybody. Good night.
Thank
Good
you.
night.
I can't believe
Good
you.
night.
Thank
Wonderful
you.
discussion.
They can't hear me. That's funny. That's funny. They can't hear me. That was funny. They can't hear me. They couldn't hear me. My microphone's only going here, but that was funny. I did not expect that. But I was in their chat room. That's where I was getting the links. And I mean, I hope my microphone was off. No, because if I said things on the mic, no, they would have, no, I wasn't. I was in the audience. I wasn't. There's no way my mic went live on their end. Who knows, though? God damn. That was funny. So this is, it's funny, when we started putting this book together, I remember the discussion, there was some discussions about it, and I was like, oh, okay, all right, well. I didn't know how big of a deal COVID was going to be. Soo-Hin Lee had come to the Solidarity Center here in New York to give a report on China, and it was Soo-Hin and Sara, and I think it was on Hong Kong. It was on Hong Kong protests, and then it was about the Belt and Road. Like, those were the two. Yeah, he yelled Twitch, and they yelled it back. Yeah, that was pretty funny. That was pretty funny. That was a moment. I'll have to clip that. Send it to Margaret. That'll be funny. I'm tickled. So, but anyway, so they had come. They had Soo-Hin Lee had come, and to give a presentation on the Belt and Road, and Sara started off the presentation in the meeting with a report on the Hong Kong protesters, the class nature, and of the rioters in Hong Kong, and it was a really good night. And I happen to what I do, one of the things that I do at the Solidarity Center is I run the audio and video when I'm available, which is a lot. Not only for Workers' World events, but for International Action Center events, call to action, or whatever group is meeting there. If I'm available, I'll come in and run, or if we have anyway, there's a lot of different groups. So it's been great because I've got to see a lot of excellent speakers come in for different reasons on topics that I didn't know anything about, or I only knew a little bit. I guess that's one of the reasons I tell people that they should join an organization, right? Don't do your activism all by yourself or with one or two people. I mean, it's better than nothing, right? But if you join organizations, you get involved and you start meeting more people and understanding more all the different struggles, and then start seeing how they all connect, and there's just a higher percentage chance that you'll get deeper and deeper, deeply involved, and more radicalized, right? You get to the root of things by joining organizations and organizing together. So that's one of the reasons I always say, join, right? Do we have admins here to start deleting the trolls? Oh, do we have do you think Ironical is a troll? I don't think Ironical's a troll. Who are you talking about? I was busy doing something else, so I missed whatever's. Nice panel. Yes, Iced Morty, you're welcome. I'm thrilled to be able to bring these kind of folks. You were watching reports around Christmas? Yeah, by January, telling everybody to be ready. No one believes, though. I said it's the new flu. Oh, well, it's not the new flu. It's a little more than the flu. Yeah, I don't know if it's forever. Maybe. Yeah, Junk Lord. Yeah, use your judgment. We haven't talked about that. I made you a mod the other night when I may have been not strictly sober, and I don't know. I was unable to keep up or do what I needed to do. So I appreciate your help, and I appreciate all the mods helps Treble and Subcountable. Thank you for helping the stream. I get silly and I get weird and I lose my shit and all the human things, right? But I try to bring good content too. I never want to have one of those round table panels that you see on Twitch with all the everybody just throwing shit at each other. I don't want to do that. I watched a couple of those when I first got here. I was like, God damn. But I've been there. Anyway, so I have a choice here now. Do we keep the stream going and chat and do other things and look at other videos? Oh no, you know what? I can't keep the stream going. I have a job to do. I literally have a job. One of my jobs is to post the new articles at Workers World at workers.org. And on Tuesday nights, I never stream this early, right? I stream this early on Thursdays because that's when the webinars for Workers World are. But since Popular Resistance was doing this with that panel, I'm like, yeah. So I'm gonna have to close this stream by 10 o'clock, maybe another 10 minutes or something, and because I have to go do my work. Or I could put on like an hour-long video and turn the volume off and do my work in the background. I think what I'll do is I'll close the stream out and then I'll come back around midnight and do a couple hours with the regular content, the stuff that I curated. So anyway, I hope you all like that. Please check out the links, those websites. And what's funny is everybody that was on there, they all represent orgs that I regularly look at. And they're under the trusted news and analysis in my Discord. Don't drop out of your biology class, homie. Oh, okay. Yikes. So you had flu symptoms, and then you did you test positive? What? Any new flu? Oh, any flu now is immediately considering COVID-19. I see what you're saying. So if there's a significant number of long COVID symptoms that cause severe health issues, and COVID could become an annual kind of thing like influenza, imagine how quick these health issues like organ damage, yeah, exactly, are going to stack up on the population within a few years, and the cost and the death toll. It's terrifying. It's fucking terrifying. It is. Yeah, I think I see what you're saying, Iro. You're saying even if you just have the regular flu, if you get some flu symptoms, your mind immediately goes to, oh my God, it might be COVID, and you have to quarantine yourself, right? So I totally get that. Right? Yeah, I mean, Mrs. Bear had some symptoms, scratchy throat, dry cough, and she was worried sick, but she went and got tested when somebody in her workplace, somebody that works in a room this size right next to her, 6 feet away, 5, whatever, tested positive. So she can't go into work still, even though she tested negative. Mrs. Bear tested negative. She still can't go into work because it could be a false negative. She can't go in for another, I don't know, 7 days, 8 days, or whatever. Your allergies have been so bad, giving you anxiety attacks, thinking it's COVID. Yeah, that would be tough. Do you see your bandmates, Junklord? Do you like get together on Zoom and do band jams on Zoom? Or do you collaborate on new music, doing your parts and sharing them on the interwebs and making new songs? Do you do any of that stuff? Or is your band just like strictly cover of blues for live? I was just curious. How's that impacted? Because I'm sure all the bars are closed, right? Yeah, close contact here in New York. Oh, they aren't techie enough? Okay. Oh, wow. You haven't rehearsed in a year. God damn. Yeah, the state of the arts, like Broadway and live music, the state of the arts, when things kind of get back to normal, if they ever do, is going to be diminished. It's going to be definitely diminished. Discount tickets for Broadway when it comes back. Oh, people that have COVID or have had COVID, when they get the flu, will they feel worse? I don't know. Bars are open, but any live event that could draw people are banned? Wow. So you can have a bar that's open and every other bar stool or some shit? Oh, man. My parents live where you live, right? And luckily they have 1,600 square foot house or something, so they got plenty of room, so to speak. But they're in their early 80s, so it's not like they're going to bars. Video poker at the bar, but you can't play Pac-Man? What the fuck? Well, Rad, we know the answer to that, right? Why won't they do it? What Vietnam did? Because capitalism, right? I mean, literally, that was rhetorical, I'm sure. You know why. It's really, this has been such a revealing experience. Like for people who never questioned capitalism, people who never questioned for-profit healthcare because maybe they just happen to have a good job with good benefits, or they happen to have a shit ton of money. Those kind of people, they're watching a really good lesson in how capitalism kills. And it's just amazing to me that people are still anti-mask, and that anybody can look at this as anything other than a massive fucking catastrophe, failure of the capitalist system. It lays bare everything we've been saying about capitalism. It just lays bare. Yeah, America, baby. That's what it is. It's capitalism, not. Oh, I thought that said Pelosiism. I'm like, Pelosi? What does she have to do? Not peopleism. It's capitalism, not peopleism, baby. What's up, SJ, aka SJ? Pac-Man. Oh man, I've been watching there's a series on Netflix called High Score, and it's like a documentary about the video game business industry, starting with like Pong and Atari and interviewing all these people and all this old footage. And then, then you get the Pac-Man and the Donkey Kong and yada, yada, yada. And, the music behind it, and marketing and what wave. Anyway, it's fucking fascinating. Fascinating. Because I came up with, we didn't have a Pong game when I was a kid. It was too expensive. We didn't have any money. I didn't get a home game until I was in my late 20s, and then I got a used Nintendo and played Super Mario Brothers on this big fucking TV. Anyway, the games that shaped us. It was called High Score, and there's like several different hour-long episodes, and I think I'm on like the number 3. But it's been really interesting. Kind of nostalgic, I'm also feeling my mortality. Feeling old. Right? Was in the grocery store the other day, and I rarely get out to do things like this, but we went out to get Mrs. Bear tested, and we got our number. We waited in line. We got our number. Then we had a couple hours to kill. We did a couple things around the neighborhood. And we went to the grocery store, and they're fucking playing. They're playing like Genesis. They're playing Madonna in the grocery store. Like, Jesus, they're like, fuck. They're playing like shit from the 80s. I'm like, you're old when the stuff that you dug when you were in your 20s comes on the grocery store playlist. Yeah, the guy who holds a high score for Pac-Man is insane. You can barely beat I could beat like 23 screens. I could beat a shit ton. He beat 200 levels. Jesus Christ. Yeah, I didn't know that there were 200 levels. I thought there were, maybe 30 levels, 50 levels. I didn't know. 200 levels? Holy shit. The movies that made us, and the games that made us. Good, I'll check it out. Yeah, it was Phil Collins. It was, I can hear it, feel it coming in the air at night. Oh, Lord. Journey Quest. Arcade game. Oh, I don't know that one. I don't know anything about that. Oh, wow. Yeah, when the casino stopped playing 50s rock and roll and started playing 70s and 80s. Right? As the people, you every year forward, you bring it up a year because you have that target audience that you're really playing for, and they're a certain age, certain demographic, and so every year it moves. Every year, some people die or quit gambling or quit drinking. And more people turn 21. I used to have to do that as a DJ every year. Like I DJ'd for 20 years, right? More than that, really, but full time, for 20. And every year I'd have to it wasn't but over time you would just take some stuff out of rotation, and well, that's, 6 years ago we could play that occasionally, and there were people that would get it, dig it, and just rotate it out. Phil Collins isn't that bad. He's not that bad. Come on now. You're going to keep it real? You folks keep calling shit right now? Calling shit right? Oh, we keep calling shit right. The tankies are calling shit right? I think so. It was banned and the Secret Service took it. It's the same creators from the Illuminati card game. I have no idea what this is. No idea. I have no idea what any of that is. Yeah, tanky's generally an insult, but Rad, you know that, but it seems to be on Twitch, it's not as much of an insult. It's kind of it's like me saying Demsock. It's kind of a description. Oh, he's a Marxist-Leninist. Who wants to say Marxist-Leninist? Tanky. But if they go fucking tanky, right? So it's kind of like when I lived in Hawaii. They have a name, they have a term, a word, Hawaiian word for like visitor, somebody who's not from here. And but it generally refers to white people from the, and it's haole, Haole, Haole. And if somebody says, oh yeah, that haole over there, that's no problem, right? But if they go, that fucking haole, they do that, then you done fucked up and you're in trouble, and you probably owe somebody an apology, or you need to get out of the bar real fast before you get crushed. Haole. Yeah, in Hawaiian, you pronounce every single letter. So, ha-o-le, right? Haole. But, it kind of comes out howly. How. You just picture Stalin rolling over Nazis in a tank. Anyone says tanky? Yeah, there's a great meme, one of these tug-of-war memes, where it's like the anarchist is tugging a war with doing a tug-of-war with the capitalist with the monocle and the top hat, and he can't do it. And he finally, the anarchist looks over and he goes, "Okay, we can use your tank. Can we use your tank?" And then the two of them pull the capitalists over in the tug of war. Illuminati card game. I don't know anything about this, but y'all have a good talk on that. Listen, it's 10:00 p.m. on Eastern. I want to be back at midnight to do my regular stream tonight. Tonight I was here for the COVID. The book is Capitalism on a Ventilator, and anyway, I want to end this because I have to go post the Workers' World articles. There's going to be 5 new articles tonight. I have the list, but it came in during. Anyway, I have to go do this. It needs to get done, and so I'm going to end the stream. And I'll be back at midnight. And go to workers.org. Go to workers.org right now and see what the last 5 or 6 on the splash page are. And then an hour from now, hey, Half Truth, how are you? Did not see you in here. When I come back later, you can see the new ones. You can see the new ones. I'm looking forward to the one about the Amazon workers that are organizing down in Alabama. So. All right. Peace, everybody. Thank you for coming. 2 thumbs up. Should we raid into someone? Let me look. Let me see who's. I've never raided anybody at 10 o'clock. Who's on? Here, I got the mod view. Other channels I follow live. Let's see who's on. Left Flanks. Dirtbag. Silver, let's go. Oh, Silver's playing World of Warcraft. Or Nancy Krilosi. Devil. We raided Nancy before. Let's raid Devil. Let's go raid Devil. There it is. Oh, I hit the button. We did it already. Oh, Devil has an ad. Jesus Christ, I hate ads.
Buy Totino's and get bonus in-game content.
Something fascinating about the attempts to make him seem overly powerful or sexy when he's just an old guy. He dances like
Did we go?
Chaperone. He stands like
Are
he
y'all
has
there?
no knees. He has resting toddler face. Again, whatever.
Wait a minute.
It
Did
all
we
kinda
raid?
Seems like a dull afterthought from the
What's up,
tweets and
Pinko?
stuff, but I just like to take a moment to really show